My name is J.Ryan Quinn. My specialty is total joint reconstruction, so I do a lot of hip and knee replacements. I also do a lot of revision joint replacements and also robotic joint replacements, so I do a lot of Mako knee reconstructions of the knee and hip. I'm based out of Oxnard, Camarillo, and also Simi Valley. I grew up in Salt Lake City, Utah, in the mountains, so a little different than the beach, but definitely enjoying the beach now that I'm out here. I went to the great University of Utah. After that, I went to medical school at Medical College of Virginia. It's also called Virginia Commonwealth University School of Medicine. If you've seen the movie Patch Adams, it's the same school he went to. After that, I went to residency at UC Irvine in Orange County, and then I went to my joint reconstruction fellowship at Scripps in San Diego. Being a doctor to me has kind of honestly been a family trait. I mean, I'm a fourth generation doctor. My great grandpa was a doctor. My grandpa and my grandma were doctors. My father is a doctor. And so it is kind of a family tradition. But besides that, I think the main thing is most people become doctors to be able to help people and improve their lives. Conditions I see mostly in clinic are arthritis, so hip and knee arthritis. I see pretty much anything with hip or knee pain, so all conditions that revolve around the hip or knee I will see, including meniscus tears, labral tears in the hips, things of that sort, but the main thing that I do see is hip and knee arthritis. So my philosophy of care is pretty much based around improvement of quality of life. I mean, that's why people come to orthopedic surgeons. You're coming because you have some form of musculoskeletal injury, and that musculoskeletal injury is limiting your quality of life. It's preventing you from doing activities that you like. So my goal is to try to do something, whether it's as simple as physical therapy or as invasive as surgery, to improve the quality of life. And so that's the ultimate goal, I think, of most orthopedic surgeons. And my philosophy of care is to try to do what we can to get you back to where you want to be, or as Ventura Orthopedics says, get back in the game, I believe. So that's the goal, is to get you back in the game. I definitely have had numerous knee surgeries. I injured myself playing basketball at a younger age. I even recently had an injury that required surgery about 18 months ago. So definitely have had my fair share of surgeries on my knee. It does significantly limit you. I mean, having a knee injury, limited everything I could do. I wanted to get back into living my normal lifestyle, sporting activities, whatever it may be. Just like everybody watching this, they want to get back to the activities they want to do, whether it's hiking, even things as simple as walking, just walking without pain. But ultimately, yeah, the end goal is to get you back to what you want to do, which, is what I ended up doing, having a couple knee surgeries, and now I'm back to doing what I want to do. The main thing I like to do is be with my family. I mean, I think that's probably a pretty common answer. Be with my wife and my 2 kids. We're currently expecting a third as well. We live in Southern California, so the ultimate goal is to be outside and enjoy the beautiful weather we have here. Golfing is probably one of my biggest hobbies, sporting activities, those types of things are things that I truly enjoy. A special interest of mine is robotic joint replacements. People watching this video are going to question, well, why should I do it traditionally versus robotic? And I think the main thing that's been shown by a lot of the literature out there is it's more accurate and more precise. That's one of the biggest benefits. It also can match the patient's anatomy much better. I can use the imaging that I have gotten preoperatively and match that during the operating room, which I think does relate to a faster recovery and quicker movement. And a lot of the studies do confirm that, showing that there is a slightly faster recovery, that there is less pain med consumption, a lot of benefits of doing it robotically. And again, I think, as I always tell people, the more information we have, the better off we are, right? I mean, if I were to have my knee replaced, I would want to have as much information as possible.